Health here at CareSource, and I will echo the sentiments that was said by DCH leadership. It is so great to be here in person. You know, the first full in-person Medicaid fair coming up on 4 years. So thank you so much. It's great to see some familiar faces, some people I haven't seen in quite some time. We have a great agenda for some questions put forth by the department that we're going to talk to you about over the next hour. Should there be any questions, please save those for the end. In addition to myself and the other leaders we have here in the room, CareSource will have a booth and a table set up outside. In case there happens to be any one-off claims questions, we're happy to take that offline. So again, in addition to thanking DCH for putting on another great Medicaid fair, I want to thank the providers and everyone in the room. You know, CareSource as a whole is very social determinant and whole person health focused. We can't do that without your partnerships, your cooperation, any type of pilot project. So I want to echo again the sentiments of this morning. Thank you all for you do, not for only for our members, but the community at large. So I can't understate that and say thank you. Agenda-wise today, I'm going to talk a little bit about parity at the end, but I have the honor and pleasure being joined by my colleagues behind me, Ariel Estevez and Naoki Cormier, respectively, our Vice President of Clinical Case Management and our Director of Case Management, are going to talk about care coordination and case management today. You're also going to hear Chastity Harvey, who's a manager, talk about some of our value-based benefits and provider incentives. And Ann Pittman, who's a manager within the network space, is going to talk about a whole host of things related to contacts and VBR and incentives as well. So other part I will say, CareSource, I think some of you have heard this before, but to reiterate, CareSource is coming up on 36 years as a leader in the Medicaid space, managed Medicaid. We are the only nonprofit here in the state of Georgia. We've been here for 7 years, and we look to continue to build out our brand. CareSource as a whole started 30 years ago in Ohio, as you can see on the map in the upper right-hand corner. In addition to Ohio, we have a presence in, but not limited to, Indiana, Kentucky, West Virginia, North Carolina, Arkansas, Mississippi. Michigan's not on there, that recently went live, as well as our great state here in Georgia. So big focus for us. We pride ourselves in being out in the community to meet members and providers where they are. And that is probably a great segue to turn it over to my colleagues to talk about case and care management. So Ariel and Naoki, please take it away.
Good morning. I'm Ariel, and I am accompanied by our dynamic Director of Care Management, Naoki Cormier. One thing that I wanted to ensure that we talked about today is the importance of care management and how we do it at CareSource, and the difference between care management and care coordination.
Good morning. I didn't hear you all. Good morning. I am so happy to be here alongside Ariel and my colleagues. So we're going to jump right on into it. Let me just put this here. So there's a lot of questions right around care coordination and care management. I'm going to step away because I know that my voice carries a bit. We get a lot of questions. So it's, what is care management, right? What is care coordination? Are they separate entities, right? Separate approaches? Or is this interlocking on some level? Or with care management, does care coordination come in at some point? When we think about care coordination, we're talking about being a conduit between members and providers. We're talking about appointment scheduling. We're talking about transportation coordination. We're talking about health coaching, pharmacy assistance, behavioral health, etc., right? And so we like to think at CareSource that all of us are care coordinators. And what I mean by that is when our member calls the number on the back of the insurance card, they are linked to care coordinators. So for example, and you all, I am a for example person, and so I'm going to give you a lot of for examples. So for example, a member requires some type of specialist, right? They're going to call into the member services team, a team of care coordinators to help them be connected with that specialist, right? But they're not going to just stop there. They're going to think about, do we need assistance with scheduling that appointment with the specialist? We're going to think about how are they going to get to the appointment? So we're going to assess whether or not they need help with our transportation benefits. Do they have a car on their own or have access to that? So that's what we're going to think about once our members call in. But for my providers in the room, you also are care coordinators. So when you have a patient that comes into your provider office and their chief complaint is chest pain, you are assessing whether or not that particular patient requires a referral to a cardiologist, right? Or it may be more intensive where you need to think about, will I make a referral to this person to get to the ER, or maybe a direct admit into the hospital depending on the severity of the situation. So you too are care coordinators, okay? Now, when you think about care management, it's a bit different, right? So care management more so is an approach to where members are assigned a care manager to work intensively with whatever their chronic condition is, their behavioral health concerns, their emotional concerns. We wrap around that particular member. They are, we talk a lot about overall health coaching. We talk a lot about ongoing supports. We talk a lot about person-centered individualized plans. And what that looks like is we look at what's happening with our members and we create goals with them. And so we are constantly following up with them. We're assessing, we're reassessing, we're doing telephonic outreach, we're completing home visits, etc. Okay? So I want you and let me add too, our care managers are licensed social workers, they are master prepared clinicians, they're RNs, they're LPCs. So these are the folks who are wrapping around our members, right? And so what I want you to think about and leave from here, care coordination and care management are two entities that work together. You do not have to be in care management in order to be care coordinated, right? Care management, as I said, is an individualized program that we have. And so within the care management space, you also pull in care coordination. So for example, we're working with a member who is diabetic. That member may have social determinants of health concerns as well. So we're outreaching them, we're educating them, etc. And then we will also act as care coordinators where we are linking them to specialists. We're arranging transportation, etc. So both care coordination and care management, while separate entities, in care management, they are interlocking. Moving right along to our integrated care management program, and I just want to leave you with our member is in the center of everything that we do. When you think about utilization management, disease management, care coordination, for example, with our utilization management, that team is responsible for prior authorizations, etc. Disease management is more of our preventative program where we're talking about chronic conditions, we're talking about self-management. Care management is what the complexities of physical health and behavioral health, social determinants of health, assessing with dental needs, etc. And then our care coordination with the member assessments and those linkages to providers, appointment scheduling, etc. So at CareSource, we really, as Adam said, we try to link our members up with everything. We're looking at the whole person in order to make sure that that member has optimal health and we have positive outcomes.
In order for our members to receive services that Naoki reviewed with us, it is critical to understand the membership. And we do that by looking at our analytic tools. We also utilize our health risk assessments because we really have an opportunity to learn what our members need. They tell us what they need, and then we go into action with providing a care manager that is assigned, and we continue to work with members with that individual plan. When members are identified through an individualized journey, we are meeting the needs of the member and the family. We want to continue to connect and collaborate with you. We want to improve the provider ease while also increasing member outcomes. Next, I am going to hand you off to Ann Pittman, and she's going to tell you about provider tools and resources.
Good morning, everybody. Whoa, that is loud. That is loud. I hope everybody is doing well this morning. My name is Ann Pittman, and I have a question for y'all. Since today is Halloween, right? Happy Halloween. What room will skeletons not enter? Anybody? The living room. So. Oh, well, thank you. I am not a stand-up comedian for sure. So, provider engagement program, I'm going to talk to you a little bit about tools and resources of CareSource. So we're going to talk about our provider engagement program overview. CareSource is committed to helping our communities gain access to high-quality care through strong local presence and close collaboration with our provider network. CareSource Provider Engagement Program is designed to focus on 3 critical components that we consider essential to building successful program, and that is relationship building, data sharing, and provider support. Now, we do have some great tools that are available on our website at www.caresource.com. When you go to our website, this is our home page, and you will see at the top, if you hover over providers, a drop-down menu will come up. And I've kind of highlighted some key areas that a lot of providers go to that are helpful. You have under provider overview, a contact us, then you have tools and resources. Well, let me back up, I'm sorry. So under contact us, right, we are going to talk about that later on, but if you click on that link, it will take you to our provider health partner network management area where you can reach out to your health partner network manager and find out their contact information as well. And then under tools and resources, there is a direct link to our provider manual and our provider policies and our updates and announcements. Now, I recommend providers go out to updates and announcements at least once a month. We publish a lot of information out there. On the first of each month, our medical and pharmacy policies are out there. Along with throughout the month, we put network notifications, and this is our way of communicating to the providers any education that needs to be sent out. So always go out there at least once a month. Has anybody been out to our provider updates and announcements site? Okay, good. All right, then we have our provider resources. This is where you can find our prior authorization tool, so there's a direct link to that, and we're gonna talk about it. And then under education, there's a pharmacy link that will take you to our drug formula lookup, and again, we're gonna talk about that as well. What I don't have highlighted, which I want to point out because we're going to talk about it, is our training and events page as well, okay? So when we're talking about that, just remember, this is how, when you get back to your office, this is where you will go to access that. And then in that big purple box, you will find a link that will access our secure portal login. A lot of people who uses our portal? I should see all the hands go up. Everybody. All right. So here, when you clicked on the pharmacy tool, you'll see on the one side the drug formula reference tool, and that is where you can put the name of the drug, or you can search through the alphabet. So if you know, self-explanatory there, right? So then just hit search, and it'll come up, and it'll tell you what you're looking for on that drug. Now, the prior authorization tool, if you enter your HCPCS or your CPT code, and then the line of products, so Medicaid. You hit search, and it'll let you know if a prior authorization is needed. So those are very helpful tools. And then remember what I said, the provider education and events tab or link that'll take you to this page? It goes to our provider education series page. And this is our training and events page, which has training modules that are available to you all day, at any time. You will have provider overview, our portal overview, access and availability, provider satisfaction surveys, HEDIS guidelines, and our credentialing overview. We also offer virtually quarterly forums. And this year we have partnered and had a BH, quality, risk adjustment, mother and baby, and access and availability standards. And if you haven't attended one of our forums, you're missing out, because they are a lot of fun and a lot of good information. So you can always reach out to your health partner to see when they're going to be, and then to receive a registration link. So that leads me into key points of contact. So if you don't know who your health partner is, you can go back, remember where it said contact us, and click there. It takes you out to our map of Georgia that has the counties. It's all categorized, color-coded by county, and then the color matches the name of the health partner on the left-hand side with their contact information, their phone number and email address. So if you don't know who your health partner is, when you get back to the office, drop them a note. Let them know you were at the Medicaid fair today and you are just introducing yourself. They would love to hear from you. Now we're going to kind of switch gears and go into our provider performance incentives. So in 2024, our value-based reimbursement participation, we had over 4,000 providers that were contracted in the VBR for 2024. Providers participated in monthly meetings with their health partner, and the incentives that were available to include the whole member's health from effectiveness of care, utilization, access and availability of care, and care coordination. Our value-based care incentive outcomes, partnership and growth, improved quality, increased outcome, and quality achievement awards. So if you are one of the providers that are listed here, this is our value-based reimbursement available to these providers. You have primary care, pediatricians, internal medicine, OBGYNs, behavioral and mental health, dental providers, health systems, hospitals, and FQHCs, along with telehealth and community service boards. So now I'm going to turn it over to Chastity.
Well, good morning, good morning, good morning, everyone. All right, my name is Chastity Harvey, and I am one of the amazing managers here at CareSource, and I am going to speak to you all about our value-added benefits. All right, so I'm going to give a high-level overview of what some of our value-added benefits are here at CareSource, and I do want to note that these are benefits that go over and beyond what we would normally offer for our Medicaid members. So I do want to point out that we offer extra dental incentives for our members. So oftentimes our members may go to our dental providers and they may get cleanings and things like that, but they realize that there are some extra services that they need. Well, here at CareSource, we like to remind our providers that for some of those extra preventative services that our members need, we offer an extra $700 that members can oftentimes use towards some of those extra services. For example, if a member may need extra x-rays, or if they may need some partials or dentures and things of that nature, we do offer a $700 allowance that can assist our members with some of those additional items that they may need. We also like to give what we call a smile pack to our lovely children. This is a way for us to just incentivize our children, to just remind them about the importance of making sure that they go to the dentist, making sure that they tap mommy and daddy on the arm every 6 months to say, hey, I want to go to the dentist so I can get that little cute smile pack. So we do offer a smile pack for our children. And then we are so excited about our YMCA benefit and also Girls and Boys Club and our Girl Scouts benefit that we offer our members. Oftentimes we know that a lot of our members, they have to work long hours and they really want to make sure that their children are safe when they get out of school. So we have partnerships with some YMCAs, and our children can go to those centers after school, so at least the parents know that those children are safe. I do want to go on to some of our Healthy Moms and Baby rewards. We are so excited because we really like to promote our prenatal and postpartum and well visits to our members. And in those, with those particular population, we like to incentivize those members because we know that a lot of our members, oftentimes they unfortunately don't go back for those postpartum visits. So we like to give our members a gentle nudge and say, hey, don't forget, if you go get that postpartum visit, you can get a actual reward that you can use towards buying groceries and things like that. So we like to remind our members that they can be incentivized. We also offer a free breast pump. We oftentimes know that, unfortunately, a lot of our moms after birth, they just can't afford to purchase a breast pump. So we like to remind our members, hey, if you sign up for case management, you can get a free breast pump. And hopefully what we found is that by offering this free breast pump, it does actually help a lot of our moms during the postpartum and just during that whole bonding time with the members. With their babies, I'm sorry. And I am so excited about this program. It's called Fitness on Demand. And I will say that this program has been a labor of love. This program is definitely dear to my heart. How many of you all know about Peloton? How many of you all have Peloton? Woo woo to all my Peloton family out there. Fitness on Demand is just like Peloton. From the perspective of Fitness on Demand is an app that our members can use to do those exercises and workouts at home right there in the comfort of their home. What we found that a lot of members don't have access to gyms. And it's unfortunate, but it's just the reality for some of our members, especially those members that reside in like those rural areas. So we said, okay, hey, what can we do as a company to make sure that our members are staying healthy, that they're still able to move around and get around, and just be kind of innovative. So we partnered with the Fitness on Demand team, and now we are offering some in-home exercise classes to our members where they can exercise at home, they can learn how to cook, they have access to recipes and things like that. And what we found is that when members are active, it really helps with their mental health, it helps with their physical health, and it just helps them to feel good all the way around. And I do want to close out with Fitness on Demand by saying that this is an app that the whole family can use. And we are so excited about that because oftentimes mom or dad, they may go to the gym and the children are not able to go because some of the gyms just don't have childcare. But with Fitness on Demand, we can have mom doing her thing, we can have little baby doing their thing, and they can be doing everything together as a family. And I do want to talk about our amazing life services program. What we know right now is that a lot of our members are having some financial difficulties. It's difficult right now for members, and our life services program is here to connect members with resources in the community. We connect members with job resources, we connect members with housing resources, and we also connect members with food resources. Because how many of you all know that, unfortunately, moms, dads, if they're sick, but they don't have nowhere to live, what do you think is going to be more important to a mother and a father? It's going to be making sure that they have a roof over their head. And that's why I'm so excited and so passionate about our life services program, because our life coaches work hand in hand while our case managers are trying to get mom, dad, babies connected with doctors to ensure that their physical health is being addressed. We have our life coaches over here connecting those members with their resources in the community to help them find housing, to get them connected with employment. So we are looking at the whole member. We understand that mom and dad can't just focus on their health when they don't have somewhere to live. So we want to focus on both things simultaneously. And I do want to say that we have a program that we just kicked off last year. It's called My Money, My Future. Sometimes I feel like I want to do a rap song when I say My Money, My Future. But we are so excited to partner with this amazing organization, Habitat for Humanity, because they actually come in and they offer sessions that teach our members how to budget, how to prepare to buy their first home. They also give them money to help them towards their first home. It's an amazing program. Our members seem to enjoy the program, and we enjoy the program because we have the opportunity to go out in the community and help build houses for our members. And how many of you all know how exciting that is to be able to ride down the street and you looking out your car window and you say, hey, I see that pink house. I had my hand in that because I remember banging on that nail, and I remember the excitement and the joy that the member had when they first walked in the door of their new home and them feeling like, wow, I did it. And us as a health plan saying, wow, we helped them do it. So it's just a wonderful feeling, and we love this particular program. And then I want to close out by saying CareSource is doing some amazing work in the community. We have several programs that we do throughout the year that's called Paint the State Purple. How many of you all have heard of the Red Table Talk with Jada Pinkett Smith? All right. Well, CareSource, we actually paint the state purple every quarter. And what that means is that we go out in the community, we meet our members where they are, we offer them food baskets, we ensure that they have, that their well visits are being conducted at these events. We're making sure that the children's dental visits are being conducted. We have job resources there for our members. We are really getting into the community, and we're meeting these members where they are. We are wrapping services around them, and we're saying, hey, we're here for you. We also have our amazing WOW event. How many of you all know that sometimes our parents, because they work long hours, they're not always able to get little Johnny and little Susie to the physical doctor. What we're doing here at CareSource is we're going into the communities and we're bringing the doctors, we're bringing you all as providers to them. And we're saying, hey,
Moms, dads, we're here. We're in the community. Come on, bring those babies so they can get those immunizations. Bring those babies so they can get their teeth cleaned and so they can continue to remain healthy. So we are doing some amazing work in the community with all of our events that I spoke of. And at this time, I'm going to turn it back over to Mr. Adam Klein, and he is going to talk about mental health parity. Again, thank you all so much for this wonderful opportunity. I will definitely say that we could not be who we are and we could not do the work that we do without each of you. So thank you all so much.
Thank you, Chastity. Your passion always shines through. I don't know if I could top your My Money, My Future dance or the Halloween that Ann used this morning. So I'm going to close at parity and try to make that as exciting as possible. But in all seriousness, as Stuart mentioned this morning, this is something that's a focus of DCH. This is something that's been a focus of CareSource not only this year and the years going forward, but as well as in the past. We want to continue to be a leading healthcare organization within the parity space. When I think of parity, especially as the behavioral health director, that's ensuring that there's compliance and equalness between behavioral health and substance abuse and what we'd also see on the medical surge side in terms of benefit availability, pricing, et cetera. And we're going to continue to shine within that space. We have a 5-year vision at CareSource in terms of mental health parity. We want to continue to meet all the state and federal guidelines. We conduct at least annually reviews of the policies to making sure that we're in compliance. As I alluded to, from our network leadership, we make sure we have adequate provider types of equalness in both, again, mental health substance abuse as well as medical surgical. We also coordinate, as you heard earlier from Ariel and Naoki talking about what we do in the case management and care management space. We also work hand in hand with those teams to link members up with requested provider modalities. So things we do within that 5-year vision. Last year was the kickoff for the inaugural Mental Health Parity Day at the Capitol. We were happy to attend that. We look forward to that, attending that again this coming year, as well as other parity events. Yearly, all, myself included, all of our team members, all of the staff at CareSource gets an annual parity training, so we're updated on the latest policies in regards to that. We also take a deeper dive and a look, and I'm going to talk about this 2 slides from now, to make sure that there's equalness between what might be a non-auth or an auth between behavioral health and substance abuse and what we would see on the medical surgical side. We want to make sure everything comes out as equal. And in the rare event that there's something that we should be doing better, unfortunately that has not come up, we will institute corrective action timely and immediately. So that's our 5-year vision. To do that and what we've been doing and to get there, it's not a one-person approach as we do for our members. It's a whole person and whole team approach. That starts with our regulatory leadership. They're the ones who evaluate, and we'll get out to the other teams what we need to do in terms of parity. And as you can see up on the screen in the graph, it's anything from our care management team, how they work with members, our utilization management team, how they evaluate potential authorizations and non-authorizations. As I alluded to, our network team, making sure we have adequacy on both the mental health substance abuse side as well as the medical and surgical side. I talked about the trainings, and lastly, I'll mention pharmacy. That also comes into play in terms of parity. We want to make sure there's equalness within the formulary for the members to get their prescriptions. And then it's not easy. There are some complexities and there are some things we've learned. Sometime, as a multi-state plan, we're in 12 to 13 states, and each state will have its different requirements in terms of parity submissions. That's a challenge. Sometimes at the federal and the state level, there's also some different things we have to submit, and it can also change based on product to product. In the opening, I failed to include, in addition to Medicaid, we also are in the Medicare space, as well as Marketplace, as well as DSNP. So we have to make sure we are up to date in parity for all the products that we manage. Sometimes submission to submission, the material that is requested is different, and that can lead to creating some ad hoc reports based on the request. So what are some lessons that we've learned? There's not really a one template model you can go to. Again, it's kind of on a quarter by quarter, state by state basis, but we do have some subject matter experts within the organization who help us stay prepared and up to date. We conduct quarterly trainings and evaluations, and we have a template made so that depending on what comes out, we can kind of adapt it to that state. This is where I needed maybe the Halloween joke just to keep it going there. So what are some things that we've learned and what are some successes? So we've received, here within the Georgia market, we have received positive feedback within the organization. We're kind of the go-to market in terms of how the other markets model what we do for parity. I've talked about the trainings that we do for all staff. When I think of behavioral health and parity, I think of access, and I think we've all seen, unfortunately, whether it's today or going back over the last 4 years with the advent of the pandemic, the depressive rate as well as the anxiety rate has skyrocketed. And in addition to our providers in the room, individual, family, group, community support, we've engaged other providers to try to, again, increase access. You've heard Chastity talk about our WOW, our Wellness on Wheels, where we're out in the community. We also have a couple of other providers within the behavioral health space. We've recently launched our Be Me app that's designed by teens, for teens. We partner within the maternal space, which we heard Stuart talk about early in the kickoff, how maternal health is something very big with Brave Health and Luna Joy. And also to promote parity, we are constantly on the medical side talking about SBIRT, which is our substance abuse screenings within the medical space. I can't understate the passion, that I feel and have, as well as, my colleagues. I hope and think and know you saw that shine through today. In closing again, before we'll turn it over for questions, I just again want to say thank you. It's not easy out there. It's not easy out there, I think, for any of us on a daily basis, let alone that you work the work that you and we all do. So I started with a thank you. I'm going to end with a thank you. And hope you enjoy the rest of the day. The Medicaid fair, we had to move a little quick because they told us to please make sure we leave time for questions. So with that being said, I'm going to turn it over for questions.
Good morning. When is open enrollment?
Sorry, man.
When is open enrollment?
Open enrollment for,
I'm a DME supplier, so I was told when I called that it wasn't open enrollment season yet.
sorry, ma'am. The question was open enrollment for DME.
Yes, DME, durable medical equipment supplier.
Yes.
Just as a provider?
Yes,
This is for Medicaid?
yes.
And are you a provider that is credentialed through Medicaid?
Yes. Mhm.
Okay. What I like to do is have you go to Gainwell, have one of the Gainwell representatives, if you all have a CBO representative, so we can ensure that you can get in contact with us and get credentialed and make sure everything is validated. Because I'm not sure if you are a DME provider, why they would say that it's not enrollment season.
I'm just coming aboard.
Got it, okay, okay. If you are wanting to get with, or have CareSource as one of your
Yes.
payers, we'd love to come to our table.
I will.
We can help you, and then I also welcome you to visit the other CMO's tables too,
I
because
will.
you want to get
All
all three
Yes.
aboard,
Thank you.
so yeah.
More over here.
Good morning. I have a question. I work with OT, PT, and speech, pediatric therapy, and we were told that we would no longer need prior authorization for outpatient services. Is this true?
Yeah, thank you for your question. I believe another colleague was going to ask that as well. CareSource has prided itself on putting our faith and trust in the provider community. For most services, historically, we have not had prior auth, and for the ones that did, it was only a prior auth needed after a certain amount. Within the last couple of weeks, a provider notice went out that there are some other services that did require prior auth up front. Some of those were PT, ST, and OT, and those authorization parameters have been pulled back where there is not an authorization needed. We have a booth, and we can get your information, can make sure you directly get the provider notification if you did not get it.
Don't be shy. This is your time.
I just need to know, can we get access to that presentation online? Or?
Yes, it's going to be available on GAMIS. So if you go to imms.gov, you can get that as well. And I wanted to add one thing that care management we did not post on our slides is how to contact us. So we have at our tables a care management flyer, and it tells you exactly how to contact us through the provider portal, through our phone number, and through the email address that we have on the flyer. His question is if this presentation is going to be available to you.
I have two questions, actually. One, I've been talking to representatives lately, and the first part is for behavioral health. When going through audits and that sort, or PPRs and that sort of thing, and trying to see about regulations and that sort of stuff, and getting a response back from the auditors, we're trying to figure out what, as a provider coming from different aspects of knowing what our standards are supposed to be, what we assume, compared to what standards are that are being judged against medical records. Is there a standard in general from, are you going by CMS's regulations? Are you going by something else? We're trying to figure out where we need to go as providers to make sure that we understand what our role is as far as documentation and that sort of thing.
I think the easiest way is to link with one of our health partner representatives, and we can come to your office and sit with you and go through each metric just to make sure that we are aligned with what you all are doing at your office and what the expectations are. Would you be able to meet us at our table and we can connect further?
Back to the OT, PT, SLP. When I've discussed with reps and also customer service and that sort of thing as far as the questions, as that standard on that medical side, we are trying to understand, because DCH requires us a certain limit of visits and that sort of aspect. And what we're assuming that is supposed to be happening now with CareSource because of the lack of authorizations. Because when we ask questions in that perspective, they are often referring us back to, well, we follow DCH guidelines. That's great, but DCH guidelines has visit limits. And there's certain things that with intensive outpatient or certain circumstances that we need above and beyond. And now if we can't get those authorizations or they are non-existent, now we're wondering what happens in these circumstances as to not kick back or trigger an algorithm to make sure that we aren't reviewed and delaying services because we're being reviewed.
Yeah, I would echo what Ariel said. I mean, I'm happy to take it offline without knowing the type of review that you're referring to or even, specific provider type. Kind of need more information. Happy to stick around after. Again, the provider notice just came out, and those, as with the question over there, those prior authorizations have been rolled back. I don't want to say it's as simple as submit the claim, but it's as simple as submit the claim. There is no prior auth. If I understand what you're saying, your concern is potentially overutilization.
If we have to, as a provider, use intensive therapy for whatever particular reason, situation, and it happens to be a requirement, DCH requires us to go through authorization period for it and request that, and that's fine. But now we don't have that option with CareSource to request that because there's no authorization required.
Sure. And when you say, I'm sorry, I didn't mean to interrupt you. Go ahead. When you say intensive therapy, I think of IOP?
It's PT, OT, SLPs. So when you're doing intensive therapy, you could do it for 2 or 3 hours a day for whether it's rehabilitation or something along those lines. I am talking about peds, I'm sorry.
Okay, that's okay. I mean, again, at this point, and again, I recognize that this just went into effect within the last couple of weeks. Nothing's been brought to my attention in terms of overuse monitoring. It's literally the authorization parameters have been pulled back, and I kind of go back to what I said. We put our faith and trust in the providers for you guys to do what's clinically appropriate, to bill and use what's within the scope of your practice and your license and what's within your fee schedule. Happy to hear and learn more, at our network table, if there's a specific concern in regards to what DCH is saying and how you think that would affect in terms of just submitting the claim.
Thank you, Becky.
Okay, I have a question here. The first one is on contracting. We got credentialing approved over 60 days, and I called for confirmation. They told me the contracting would take another 30 days or 60 days. But we are above that. We have not received any contracting.
Our network leaders are here, and I'm sure if you come over to the table, Becky's in the back, she has her hand up, and I'm sure it's something she can look with her team to see the status of your contract. Sorry for any delay.
To Becky. Okay, the second one is after being contracted with CareSource, do providers get referral from CareSource or about the referral for clients?
So it sounds like you're trying to increase volume for your practice, and you want to know if we refer patients to. So usually what we do, we put you on the provider portal or the provider lookup list, Find a Doc tool, so our members can look and put in their zip code, they can go through the filters and they can find you. So that's the first step. The second step that we ensure that we do is within care management. If we're looking at our Find a Doc tool as well, we will refer a member to you as well. If it has accepting patients, we will often refer. So we just have to get you on that Find a Doc tool, and when there's a need, absolutely, we will send patients over to you. You will also receive a call because our care managers will call and sometimes have the member on three-way with you in order to coordinate that appointment.
Is there an enrollment time frame for newborns, and if so, what is it?
For newborns, when a mom delivers who is a CareSource member,
Yes.
what happens, we usually have it under the mom's Medicaid number, and as soon as we get everything in, sometimes there's a little bit of a delay, as you probably know, if the baby's in NICU and there's an emergency situation, but it's usually within 24 hours. It goes from baby girl Johnson to the actual name of the baby. So we work really hard, but we are dependent on the information from the provider to get everything up in the system and going. And we also have to have that information on the 834 file, which we get daily.
One more question. Does CareSource cover hospice services?
By hospital, do you mean inpatient, acute, delivery?
He said hospice.
Oh, hospice. I'm sorry.
Hospice services.
Yes.
When
Yeah.
there is a need, yes, we provide hospice services, absolutely. We have to have a authorization in place, and we review the medical records, and we provide hospice services. Yeah.
I have a question. When mom delivers, like the baby delivers in the January, then second one comes in November, and the claim always denying is the 1 year gap.
Can you repeat that?
So, it's an example like the baby delivered in January, first baby, the second baby in maybe November or December, and always my claim denied saying the benefit reached.
Just so I understand, are you saying that a mom has 2 babies in 1 year,
Yeah,
it's
1
getting
year.
denied? Can you give us those examples? Because if you are having this situation, something that we definitely do not want to happen for mom. However, because we want spacing, right? However, if this is happening, we need to know about it. So meet us at our table so we can take that information and ensure that that claim is approved if the member
Because
has
I did
CareSource.
appeal too many times, spoke to provider rep, and still it's keep continue denying.
We'd like to look at it, and we want to fix it. So get that information to us, because that's really important that you get reimbursed for the services that were provided for a member that meets eligibility.
Okay, thank you.
Good morning. I was wondering if anybody has noticed the greater number of autistic children that we are having to assess. And I was hoping that we could probably put something into place to more fast track getting the psychological evaluations done so that we can get them into therapy as soon as possible, as we know therapy works. And the earlier we can identify and get them into care, the greater the outcome. We see a lot of autistic children. Unfortunately, in my practice, we have a lot of members from out of country who have come in, and we are seeing a much greater rise in autism. So I was hoping that somebody could look into that and maybe do like a fast track program for children who are suspected of having autism. I know we go through the Q-chat, the M-chat, all of the ASQs, we're doing all of the work, and educating our parents that this is not the end of the world. Autism can be helped. We have layers and layers, and they need more education. So the stigma of having an autistic child goes away. So if anybody could help on that, that would be awesome.
Yeah, thank you for saying that. Prior to the advent of the autism benefit about 5.5 years ago, it was a great work and win collectively among the CMOs and DCH within the Medicaid space, but prior to that, all kids were afforded were PTSD and OT. So it was a slow, for the first part of your question, yes, we've seen the increase. It was a slow climb over the first couple of years, but within the last maybe 2.5, you could almost doubled the amount of kids which are getting services, which is not a bad thing, because again, to your point, I think the recognition and the need is now maybe brought more to the forefront. It's maybe what ADD and ADHD were, mid to late 90s. I think that's what we're seeing now. So I don't think it's a bad thing that it's there. And I also agree with you clinically, sometimes the stigma is there. We pride ourselves at CareSource on making autism a priority for us. So in terms of, getting the diagnosis and getting it there, I'm happy to talk to you after this if you have some, one-off ideas. Our turnaround time's pretty quick. We're not looking to hold up any type of initial eval, whether it's from a child's primary or from an autism provider, and we turn those around pretty quick. Thank you for your question and statement. Yeah.
And I think we all can talk about the many issues with it. It's a workforce concern, and I think it's more than just everyone that is in this room. It's a legislation issue. It's a workforce issue. We need more providers that can, because when you're overworked as a provider, that definitely plays into the ability for our members to access. And I think as we go through the next couple of years, and you heard Stuart speak to, one of our priorities is behavioral health, and it includes that population. So I'd like to and welcome you, if there's an opportunity for us to collaboratively think through how we could work through some of the issues, please reach out.
Hi. I just wanted to add one piece of information to that for all the medical physicians and pediatricians that I provide at my clinic OT, PT, and speech for the children, and they can start receiving services with a developmental delay diagnosis while the autism diagnosis is in process. The only hang-up is the ABA services require the autism diagnosis, but they can at least get started.
Thank you for that comment.
So we have noticed an uptick in a change of coverage for our clients, and when we contact the parent, they are also saying that they have not been notified. So just wondering, has there been any advancement or any updates regarding getting that notification to the parent?
So we know that our members are transient. They may have an address on file, and we're working so hard, all of us, on ensuring that we have the appropriate address on file, because a lot of the communication is going out through mail. And if they don't live at that address any longer, they're definitely not getting the information that they need. And if any of you are parents, you understand that a date goes right out of your mind, even if it is something so important as making sure your child has coverage, insurance coverage. So we're working really hard on ensuring that members have the information, and we're updating our addresses. Once the member learns that they do not have coverage, they can call or go into the Gateway portal and start that process again. The unfortunate part about it is if they had an appointment with you, it causes provider abrasion and all of that. But as soon as they get into that portal and get the ball rolling, you can reschedule that appointment to avoid any further delay.
I do want to state, while we're waiting on any more questions, please do not forget to fill out the evaluation forms. We really do need those forms.
Thank you all for your time.